I'm Keith Armbrecht, founder of Medicare on Video. And if you're watching this video, you're likely a client of mine. So this video is only going to go out to existing clients. So first off, thank you for allowing me to help you with your Medicare choices. And I wanted to clear up some confusion because we are at that time of year again. It is Medicare open enrollment time where you are going to be bombarded with mail. You're also going to see every commercial on TV is talking about Medicare Advantage. Primarily United Healthcare is talking, Humana is talking, telling you how wonderful their Medicare Advantage plans are. So a lot of people get confused on do they need to actually do something during open enrollment. You can see here the dates for open enrollment starts on October 15th and it runs through December 7th. So the big question is, do you need to do something? And if you're a client of mine, you chose to stay with Medicare A, Medicare B, and you chose a Medicare supplement to cover what A and B do not. So the good news is open enrollment does not apply to Medicare supplement plans. You don't have to do anything to continue your coverage, or you can certainly shop, but you can shop any time of year. You don't have to do it during open enrollment. So it takes all that away. You don't have to worry about meeting any deadlines or timelines or things like that. Now, the reason that you chose to stay with original Medicare and a Medicare supplement is likely because you wanted the flexibility and the freedom to do whatever you want to do with your healthcare decisions. So that's the biggest difference between Medicare Advantage and Medicare supplement. On a Medicare Advantage plan, it is much more of an HMO environment where you have to go to a network of doctors and a network of hospitals. Sometimes you have to get a referral to go from a primary care to a specialist. So it's definitely not as easy to use as a Medicare supplement. When you have original Medicare with a Medicare supplement, you can go to any doctor, any hospital in the country that accepts Medicare. You don't have to ask for permission ahead of time. So the out-of-pocket expense is also generally much less on a Medicare supplement than it is on a Medicare Advantage. So don't worry about paying attention to all the fancy, shiny things that they're trying to convince you to come into a Medicare Advantage plan. You likely would be much happier with your Medicare supplement plan. So hopefully we made that right decision right in the beginning, which is the way most people want to go. So what does open enrollment apply to? It applies to Medicare Advantage plans, and it also applies to Medicare drug plans. If you stayed on original Medicare, and again, if you're a client of mine, that's what you've done, and you have a Medicare supplement, you likely got a Medicare drug plan. So this is the time of year that you could make changes to a Medicare drug plan. So the reason you might want to do that is if things changed for you during the year. If you have different prescriptions now than when you started last year, there may be a drug plan that covers them better. So it's worth doing a comparison, and certainly happy to help with that. If you're a client, just give me a call, send me an email, and we will run a comparison and make sure that you have the best Medicare drug plan, because this is the time you can jump in and out or change or do whatever you want without any questions asked. You also may not have had a drug plan in the past and now you want to get one. This is also the time to do that. So I hope that clears up some of the confusion. Number one, if you're a client of mine, you're on a Medicare supplement plan, either FGN or FHD, and you're likely going to want to stay right there. So if you do want to do a comparison, we're happy to do that as well if we want to see if there's better pricing on a G versus another G. But you can also do that anytime during the year. So a lot of times it's a lot easier to do it when things aren't so crazy. But if there's something that you'd like help with, just give me a call, send me an email, and we're happy to do that. And don't worry about all the crazy people on TV telling you about Medicare Advantage. So I hope you found this helpful. Have a fantastic day.
Medicare on Video, Medicare